This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the International Journal of Radiation Oncology, Biology, Physics regarding the final results of the Phase 3 METIS study.
This is a timely discussion, Alara. For those of us in the OR and the clinic, brain metastases from non-small cell lung cancer, or NSCLC BM, remain one of our most frequent and challenging hurdles. We are constantly looking for ways to prolong the time to intracranial progression, or TTIP, but the limiting factor is always the risk of increasing neurotoxicity.
Exactly, and that's where the METIS study comes in. It investigates the use of Tumor Treating Fields, or TTFields, specifically after patients have already received stereotactic radiosurgery, or SRS.
Now, for the residents listening, let's go back to basics for a second. Alara, how exactly are these TT fields delivered?
So TT fields are essentially electric fields. They're delivered via skin-based arrays that the patient wears. The mechanism of action is quite elegant. They work by disrupting cancer cell division.
Right. They interfere with the mitotic spindle formation. And we've already seen this technology move the needle in other areas of neuro-oncology, haven't we?
We have. The study points out that TT fields have already demonstrated efficacy and safety in glioblastoma, which was the first major breakthrough, as well as in primary NSCLC and even pancreatic cancer. But applying it specifically to the post-SRS setting for brain metastases is the new frontier explored here in METIS.
It's a logical progression. After we perform SRS, we're often playing a waiting game, monitoring for recurrence or new lesions. If we can add a localized, non-invasive therapy that targets dividing cells without the systemic side effects of chemotherapy or the cumulative radiation dose of whole brain radiation, that's a win for the patient.
And that's the primary goal the paper highlights, prolonging that TTIP without the cognitive or neurological price tag we often see with more aggressive interventions. The study emphasizes that improved treatments are desperately needed to manage these intracranial events.
Let's dive deeper into the significance of this being a Phase 3 study. In the world of neuro-oncology, many promising modalities fail between Phase 2 and Phase 3. The fact that we are seeing final results from METIS suggests a level of rigor that should catch the attention of practicing neurosurgeons.
Definitely. And the focus on NSCLC is particularly important because of how frequently these patients develop brain involvement. The paper frames the use of TT fields as a way to potentially bridge that gap between initial SRS and eventual progression.
I think it's also important to note the delivery method, the skin-based arrays. For our medical students, this means no further surgery is required to initiate TT fields. It's a wearable technology. The patient's compliance is key, but the safety aspect mentioned in the abstract is what usually concerns us most. We want to ensure we aren't trading intracranial control for scalp issues or reduced quality of life.
Right. The paper specifically mentions the goal is to prolong TTIP without increasing neurotoxicity. In the management of metastases, preserving cognitive function is just as important as local control. If the final results of METIS support this, it might change our post-SRS workflow.
It's an exciting shift. We're moving from purely resect and radiate to a more continuous biophysical approach to managing microscopic disease.
It really is. To wrap up, the METIS study focuses on a critical need in our field, managing NSCLC brain metastases more effectively after SRS by utilizing the mitotic disrupting power of TT fields.
A great summary, Alara. This study provides a lot for our community to digest as we look for ways to improve survival and quality of life for our patients. Thanks for joining us today on the Neurosurgery Hub.
Thank you, Dr. Aris. We'll see you all in the next episode.